I'm going to share my presidential address remarks with you all, and that will segue into the first of two sessions of award giving. We will be recognizing and giving out awards for the best paper and best paper for a junior investigator published in the Annals last year, and we will also be awarding 3 poster awards as well. And then following that, we'll move into the next presentation that will be delivered by Professor E, who I don't believe is here yet, but will be here, and you can see that she's on the board there. So, let me start off by just sort of letting some of you know and reminding some of you that I am a physician epidemiologist. I work at the University of Pennsylvania, and I've devoted really much of the last 30 years of my own professional career to chronic disease epidemiology. My particular focus is on chronic kidney disease. And it was with that background that I joined ACE leadership in 2011 as a board of directors member. Then I ultimately, of course, as you must know, became the president-elect in 2015 and began working within those hallowed halls of ACE leadership, and then became president this past year. And it was really an extraordinary honor for me to do this and to work within the epidemiology community at a time where I really see epidemiology as never being more relevant to our broader concerns about population health. Now, since its incorporation in 1979, the American College of Epidemiology has really played a critical role in shaping broadly the discipline of epidemiology. I can't mention them here because there are way too many, but the contributions of the past leaders of this college are extraordinary. And they really have bolstered career opportunities for many of you, for me as well, for those entering the field, and have been an extraordinarily strong voice in promoting the importance of population sciences in the practices and policies related to health of the public. So, as I address you on this, which is the final day of my presidency, I want to recognize first the extraordinary board of directors and committee chairs whose wisdom, insights, and energy truly are the lifeblood of the college. And I think as many of you know, truly I just want to say that our structure of leadership and implementation of all that the college does really does rest on the shoulders of our committees. And so during this past year, this remarkable group of colleagues and epidemiologists allowed us to make inroads in a number of initiatives. Now, I can't actually go through all of these, but I'm going to touch on some of the most important activities just to make sure that you all realize just how many different people are working towards goals that I know that you all share. I won't spend a lot of time on the Publications Committee. Michael Cook chairs that committee. Michael, I know, had to leave last evening. We talked about their important role in the succession of the editor-in-chief role for the Annals. But I also want to say that the Publications Committee provides outstanding stewardship for all of our publications and activities and interacts regularly with the journal as well. And this is really a critical function for us. Second, I want to point out that there has been a recognition for the need for greater continuity in the planning, sort of longitudinally, of our annual meetings, like this one, as well as for our participation in future epidemiology congresses. And you know, ACE has been a primary participant in all that have preceded us. And so what we established this year was an American College of Epi Standing Program Committee, and I'm delighted to publicly thank Diana Bensel, who may be in the room, I'm not sure, and Chris Penny, who I know is not here today, not only for their very clear insights and contributions in formulating what this committee should be, but also for agreeing to be its inaugural co-chairs. I also am very proud to let you know that after a many-year effort by many different people, the American College of Epidemiology Research and Education Foundation, a nonprofit entity for the college, the mission for which was developed very substantially under Janine Bernstein, one was sitting here somewhere, term, as well as a number of past presidents before Janine. And it provides us a presence in the nonprofit world, enabling us to more effectively fundraise and support initiatives that are truly critical to the college. I'm equally thrilled that Ed Trapito, who we celebrated yesterday for his role as program chair here, has agreed to serve as the inaugural chair of a governing group that will help us move the foundation into a very active mode in the coming years. Now, substantial revisions to our admissions guidelines have been sort of needed, and we've had recognition of that need for a number of years, and I just want to really shout out to our admissions committee, Bill Pearson, Bill's probably in the room here somewhere, who really brought forward some very important changes, and we believe that that these approaches will not only maintain the rigor that's been associated always with membership into the college, but will also help us more effectively reach out to other constituencies in academia, industry, government, as well as the nonprofit space. Linked to admissions, but certainly additive and very complementary in the activities of our membership. These have been led by Christine Branch. Christine, unfortunately, couldn't be at the meeting this year. And they brought forth a number of very novel approaches. Some of these actually were codified within our bylaws recently, once again, to try to more effectively reach out to other communities and also to be able to retain our members for a longer period of time moving forward. Our career mentoring committee, Carol Burns and her colleagues on the career mentoring committee have done just an extraordinary job. They frequently are in close collaboration with our associates committee that's been chaired and co-chaired by Ali Reza Yazdi and Macarius Damian. I know Macarius is in the room right there. And they've really recrafted the ways in which the college can promote career interests of our junior colleagues who are truly the future of the college. One example, and some of you participated in this, was the speed mentoring extravaganza that took place on Sunday night. I was able to participate in this and found it really a great experience for me, at least, maybe because I didn't have to walk from table to table. Now, I can't begin to chronicle all of the financial stewardship that happens in the college. And although we're not a very large organization in terms of actual dollars, but our finance committee that's been very ably chaired by Russ Kirby, who's sitting right there. And let me extend gratitude to him, the committee, and in particular as well to our treasurer, Larry Seegers, who may be in the room, I'm not sure, for all of that stewardship that they continue to provide us. Now, our communications committee, under Emily Vogtman's leadership, has, as you all know, produced wonderful newsletters, great content, great visuals, and this is really done with just the investment of a lot of sweat equity by Emily and her colleagues. They also keep us vibrant on social media, so a big shout out to Emily. Our education committee, chaired by Sharon Seda, put together, again, really an extraordinary panel of workshops, in particular for this meeting. I think the participation in our workshops at this meeting really exceeded that which we've seen in many past years, in fact. As well, the roundtables we hear, we will hear more if you, remind you now, fill out your evaluation forms. We believe we're also very successful, and we thank the Education Committee for spearheading all of those activities. Our Ethics Committee, Jennifer Salerno, I saw some of this here, who chairs that committee, has really helped keep us focused on this content of research ethics, both within the meeting and during pre-meeting workshops. And we are deeply appreciative of keeping us really focused on this critical aspect of the practice of epidemiology. The Policy Committee, Lorna Thorpe, I don't know if Lorna is in the room this morning, but she has very ably led the college. They represent us, that committee does, on the International Joint Policy Committee of the Societies of Epidemiology. and is hosting one workshop and one plenary session at today's meeting, a plenary session that will happen later on this morning. And then once again, Steve Jacobson, who may be in the room, I don't know, there he is, has really very ably identified yet another set of extraordinary epidemiologists, richly deserving of honors that we bestow upon them, and I hope people will stay for the luncheon when those honors will be bestowed more formally. Our Minority Affairs Committee, you can see how we really are dependent on these committees. It's an amazing set of activities, led by Bertha Hidalgo. I don't know if Bertha is in the room. She was here yesterday. They really have helped us to keep this sharp focus on the importance of health disparities. They put on a very successful and provocative pre-meeting workshop on Saturday on this topic. And so, as I come to the close of this portion of my comments, I want to again recognize Ed Trujillo, who, as I said, has led the conference program committee, critical, of course, to the success of the meeting. I want to thank again Terry Fontham and Ed Peters as well, our LSU colleagues, who really have been amazing hosts for us here in New Orleans. And then a shout out to our First Point colleagues, Peter Krauke, Holly Curry, and Maria Franco, who you all have interacted with and have provided us critical logistical support both before and, of course, during the meeting. It's really been remarkable to return here to, well, to physically return here to New Orleans. We were interrupted, as you all know. And all of this group have really crafted, I think, an outstanding meeting to promote professional growth for all of us, both at the very junior phases of our career as well as those of us who are senior and have been fellows for a good while. So let me segue to the remainder of my remarks. And what I want to speak about is really the extensive shifts in health status of the population over the past several decades, and the evolving scientific landscape in human research, trends that I believe truly call for action, not just by the college, but by the larger epidemiology community. Now, these shifts increasingly demand that we as epidemiologists re-examine how we define and how we engage in the full breadth of population science research, training activities that hold the greatest promise to improve the health experience of all who dwell within our communities. Excuse me. Now, as further context for my remarks, I want to touch on what I see as sort of the evolving broad domains of population health, which I will divide for today, just for convenience and probably in an overly coarse fashion, into two components. The maintenance of health and the management of chronic illness. The origins of epidemiology are often, as I think most of you know, traced to the prevention of communicable diseases. And Dr. Fauci so eloquently described yesterday that they remain no less important today than ever before. And we cannot take our eye off of prevention and off of the challenges that we observe and experience with regard to communicable infectious illness, environmental threats, and the like. However, the developments in modern sciences over the past 50 years have fundamentally drawn us to broaden our focus beyond the maintenance of health and preventing illness, injury, and environmental toxicities. Innovations, in fact, in imaging, diagnostics, pharmacotherapeutics, surgical practice, and minimally invasive interventional techniques have all reduced mortality from all manner of illness, creating an ever-growing component of our population contending with chronic illness. These include, but are by no means limited, to marked reductions, thank you, Holly, to marked reductions in coronary heart disease, deaths owing to, a reduction in deaths owing to blood pressure control, lipid control, very effective and innovative revascularization techniques. We have now very high cure rates for many forms of chronic hepatitis that led to chronic liver disease, that led to premature death. The conversion, we talked about this yesterday with Dr. Fauci, of HIV infection into a manageable chronic illness where we can restore virtually full length of life. and vast improvements in cancer survival in various types of cancer, breast, lung, lymphoid, and many of you have followed the news recently, these remarkable strides we made in terms of treating acute leukemia. Now, according to the CDC, in 2012, about half of the US adult population suffers with a chronic illness requiring chronic medical management. That's quite a remarkable proportion when we think about we as a field of epidemiologists who are stewards of the health of the public. It's quite difficult for us not to sort of focus very, very clearly, not just on keeping the half of the population from becoming ill, but we must also ensure that we focus equally on the half of the population who already have illness and need that management as well. Now, 86% of the nation's $2.7 trillion annual healthcare expenditures are for people with chronic physical and mental health conditions. More than 2/3 of the deaths are caused by one or more of 5 chronic diseases, and you probably could all name them with me if I put them in alphabetical order. We do it in unison. Heart disease, cancer, stroke, chronic obstructive lung disease, and diabetes. Now, the burden of chronic disease is punctuated by episodes of acute illness that culminate in enormous healthcare utilization costs. Again, for example, the CDC has recently reported that 10% of all adults aged 45 and over will require at least one acute care hospitalization annually. And when you think about how sick you have to be to get into a hospital today, you realize that there is quite a bit of burden of acute illness both at the hospital level and prior to that point. Now, these population trends fundamentally present important challenges to the epidemiology community and its goals of promoting population health. Indeed, to address the health and healthcare needs of the chronically ill component of the population, epidemiology community will increasingly be called upon to ally with other research communities to identify the most vulnerable subpopulations, to discover promising and novel opportunities for intervention, and to participate in the implementation of clinical trials that will test effective treatments and strategies to reduce the burden of chronic illness. Now, as we've seen these shifts in health, the broader medical research community and the discipline of epidemiology have needed to expand their set of tools and approaches, and in fact they have, to enhance human health. Now, 3 distinct related scientific movements have developed and matured in response to these shifts in population health. The subdiscipline of clinical epidemiology, the focus on translational medical science, and most recently, what many call personalized, individualized, or sometimes precision medicine. Now, each of these represents strong opportunities for the field of epidemiology as well as the college. And I want to touch on each of them quite briefly. Now, while the development of the subdiscipline of clinical epidemiology dates back more than 60 years, I think many would agree that we can attribute a substantial component of its modern day configuration to the late Alvin Feinstein. Dr. Feinstein was a luminary who defined the field as representing the way in which classical epidemiology, traditionally oriented toward strategies in the public health of community groups, has been enlarged to clinical decisions in personal encounter care for individual patients. Now, during the 1970s and 1980s, clinical epidemiology gained a strong foothold, not only in prestigious societies such as the American Federation of Clinical Research, the American Society of Clinical Investigation, the Association of American Physicians. These are the hallowed halls where traditionally we saw basic laboratory scientists celebrated, and epidemiology was really brought into the forefront across modern medicine, but also increasingly and substantially in medical subspecialty societies, where it has seen, in fact, the greatest growth and found welcoming homes over the past 25 years. They're important components in the American Heart Association, the American Diabetes Association, the American Society of Nephrology, and on and on and on. Now, indeed, as observed by the late David Sackett, quote, clinical epidemiology was reshaping the perceptions of entire faculties. Departments of clinical epidemiology were growing in number and size, Clinical departments were carrying out more and better clinical practice research, and learned societies were acknowledging the relevance of clinical epidemiology to clinical research in ways that classical epidemiology had been unable to achieve. Now, despite the increasing separation of clinical epidemiology from classical public health epidemiology, each shares not only a focus on promoting health, but a set of methodological principles that govern acquisition of unbiased and actionable insights from human population research. Indeed, these common goals and approaches to scientific discovery reveal opportunities for greater alliances for all of us within the broader epidemiology community, in general and in particular within entities such as the American College of Epidemiology. Now let me turn to translational medical sciences briefly. We can all recognize, I suspect, contributions by a former director of the National Institutes of Health, Elias Zerhouni. Many of you will know of Dr. Zerhouni's contributions. He was the architect of what was called at the time, and this is about 15 years ago, the NIH Roadmap Initiative. And this was also sort of subtitled a re-engineering of our clinical research enterprise. And this was truly at the time a bold initiative that laid out a course for us to leverage novel molecular methods such as genomics, proteomics, metabolomics, and they were in their infancy at this time, 10 or 15 years ago. Biomedical informatics as well, advanced computational tools, novel clinical research designs, and new approaches to measurement, in particular of patient-reported outcomes. All of these were intended to synergize and to move the needle forward on population health. Now, the strong principle that patients should be engaged in all stages of translational research has served to embed these research programs oftentimes within health systems where patients reside and outside of traditional departments of public health epidemiology, despite the reliance on many of the same research techniques and similar goals to improve the health of the public. Now, the goals of translational medical science are to promote the understanding of the biological basis of disease and health, as well as to identify pathways for intervention